There are different reactions that people get when they take medications. Some of them are things that you already expect from that drug. Let's say you're having headache, nausea, dizziness. These are normal side effects that you could get from a medication. But now imagine you take a medication and then your skin starts having rashes, you start having cuts on your mouth, you start finding it difficult to swallow food or even be choking in your own saliva, or your eyes turn red, your head it's as if it wants to explode. You can't even move your legs because they are dumb or numb rather. Some people can even go as far as having something we call Steven Joseph syndrome, and that's when the skin starts peeling like you have a burn. All of these are adverse drug reactions, and this happens when your body cannot cope with that medication. Your body does not even understand what is going on. So an adverse drug reaction is an unwanted effect of a drug. That means you took this medication and you're getting a different reaction. Now let's picture this. Imagine you take an allergy medication. Of course you feel sleepy. That's a side effect of the drug. Nobody worries. But when you take that same medication and instead of stopping this allergy, you can't breathe, you can't sleep, your skin start peeling like you have rashes all over, and it just makes the allergy worse instead of treating it, then these are all adverse drug reactions to that medication, and they require urgent medical attention. Do not ignore that. So certain medications that can cause adverse drug reactions are your NSAIDs. For example, the ibuprofen, diclofenac. These medications are used for pain. However, if you have asthma or you have some allergic reaction, you need to discuss this with your doctor, because this medication could make your condition worse and it could even land you in the hospital instead of treating you. Then we have the blood thinners like your warfarin. These medications, they can thin the blood so much that it causes you to bleed, and the patient can even bleed to death. When you now start vomiting blood or stooling blood, then in this case, it means there is an internal bleeding, and you don't want to joke with this. You need urgent medical intervention. So the common reasons to this could be that you're taking two medications at the same time that are not going together. These drugs are clashing, they're interacting with each other. So that could be a cause. It could also be that your genetic makeup does not accept such drug, cannot break down that medication. That can lead to an adverse drug reaction. It could also be that you are taking a certain food alongside with that medication. This is a drug-food interaction. So this could also cause an adverse drug reaction for your body. The side effects are those normal things that you could expect from taking a medication: headache, nausea, dizziness, tiredness. These are normal side effects you could get from taking a medication. But an adverse drug reaction are the things that you don't expect. So here are some common warning signs of an adverse drug reaction, and you must not ignore them. You take a medication and your face is swollen face, start having rashes, you're itching, and the itching can even turn red and even as if your skin wants to peel off, or your skin can even peel off and form like a burn. You can't even breathe because your throat is as if it's clogged together, or you start having a nightmare when you take this medication. You can't, it's as if they are chasing you from your dream, or you start having severe stomach pain that you're stooling, even stooling blood, and then it could even lead to death.